Hi, I'm Dr. Jerron C. Hill, MD, board certified anesthesiologist. Most people think that 1 to 2 ketamine treatments intravenously changes everything. The truth is, the science says something that's very different. Today, I'll be talking about IV ketamine dosing. How many IV ketamine treatments does it take before one sees improvement in their clinical symptoms of depression, PTSD, or generalized anxiety? But first, before I talk about the dosing and the number of infusions, I would like to explain how ketamine works in the brain within the first few hours of a person receiving their first ketamine infusion. Ketamine is an N-methyl D-aspartate receptor inhibitor in the central nervous system in the brain. Once ketamine binds to that receptor, glutamate, another neurotransmitter in the brain, will no longer be able to bind to the NMDA receptor. When that occurs, glutamate has to bind to other receptor sites in the brain. That process results in an increase in brain-derived neurotrophic factor. Brain-derived neurotrophic factor elevates the mood. It also is associated with the neuroplasticity changes that are seen in the brain. That means that the brain begins to repair from cell death and neuronal destruction. You have an increase in neurons and dendrites. We learned last week that this process is called synaptogenesis, and it takes place in the prefrontal cortex and in the hippocampus of the brain. Now, as far as intravenous ketamine dosing and how many treatments does it take before patients receive clinical improvement in their symptoms of depression, anxiety, and PTSD, well, most studies show that anywhere from 0.5 to 1 milligram per kilo will cause patients to have a difference in their symptoms. They begin to feel better. How many ketamine treatments does it take? Usually 6 ketamine infusions will cause a difference in the patient's clinical symptoms. Please note that this information is highly variable, with so many patients having a mood disorder, whether it be depression, anxiety, and patients that suffer from insomnia as well, all around the world. Ketamine is an IV treatment that must be custom made for each patient. In other words, one size does not fit all. Now, next week, I'm going to talk about how long does a ketamine treatment infusion last and what measures can be taken to cause improvement for months after having an IV ketamine infusion. You don't want to miss it. Subscribe now. Please share this video with someone that you love, like it. Continue to follow me at healmedstressmanagement.com, or you can email me at healmedstressmanagement@gmail.com. Thank you, and I'll see you next week.